歡迎大家出席今日嘅記者會。咁今日台上邊兩位醫生分別係衛生防護中心傳染病處主任張竹君醫生，同埋醫管局總行政經理關慧敏醫生。稍後兩位醫生會分別匯報醫管局嘅情況同埋陽性個案嘅資料。首先請關醫生。
好，大家好。現時有2114名嘅確診病人正在留醫，當中有201名係新增嘅確診病人。需要入住隔離設施嘅病人當中，總共有1042名嘅病人。琴日新呈報咗4名嘅病人情況係危殆，4名嘅病人情況係嚴重。現時留醫嘅確診病人當中，總共有41名危殆同埋34名嘅嚴重病人。其中14名嘅危殆病人正接受深切治療，而離世個案嘅病人當中，新呈報咗7宗嘅離世個案，分別係6男1女，年齡係介乎72至到93歲。離世嘅病人當中，4位係未完成疫苗嘅3針接種嘅。過去一日有307名嘅病人康復，當中包括咗262名嘅病人出院。咁我今日嘅報告去到呢度，唔該。
係，大家好。就我哋琴日本地陽性個案嘅總數係5038宗，包括核酸檢測陽性嘅本地個案1168宗，同埋核酸檢測陽性嘅3870宗。另外我哋有150宗輸入個案，就包括核酸檢測嘅143宗，同埋快速檢測嘅9宗。咁喺嗰153宗輸入個案呢，就包括53宗係機場揾到嘅陽性樣本啦。咁另外就係喺檢疫中心或者檢疫酒店揾到嘅樣本有55宗。咁另外喺社區檢測中心揾到嘅陽性樣本係38宗。呢152宗個案呢，就嚟自33個地方啦。咁其中有4個地方呢，就輸入多過10宗個案嘅，包括英國嘅25宗、新加坡13宗、美國12宗、新加坡11宗，同埋其他嗰29個地方呢，就輸入10宗或者以下嘅個案。咁頭先關醫生都講過，我哋而家就今日有7宗嘅死亡個案呈報啦。咁我哋而家嘅總死亡個案嘅呈報嘅數字呢，係9893宗，係第5波嘅。咁喺院舍嚟講呢，我哋今日就係有7間老人院舍呢，同埋1間殘疾院舍呢，就一共呈報咗14宗陽性個案喺嗰啲院友入邊啦。咁一共有41位院友呢係需要檢疫嘅。咁喺學校嚟講呢，今日就係唔使返學啦。咁但係我哋都有建議咗4間學校呢，就一共有5班呢係需要停課1個禮拜嘅。咁其中1間呢係需要停課2班嘅。咁喺變異病毒株呢，就係L452R 嗰個變異病毒株嗰個比例呢，就而家去到86.9%。咁如果乘翻嗰社區嘅比例呢，就大概 BA.5 呢就已經去到80.2%，BA.4 呢就係6.7%，BA2.1、2.1呢就3.2%，BA2.2 呢就係9.9%。我今日報告係咁多，唔該。
而家提問時間，請大家先舉手，用我同事交俾你嘅咪發問。咁喺發問之前，請介紹自己代表傳媒機構。第一位右手邊尾二嗰行最中間白色衫嗰位女士。
係，兩位醫生你哋好 TVB 嘅。咁首先就想了解翻啦，因為係今日咧就係即係聽日起就會停呢個疫情記者會啦。其實兩位醫生有冇啲咩特別感受可以分享下呢？可唔可以都講下其實喺咩情況底下會再開呢個記者會呢？即係會唔會話確診宗數去到邊一個水平會再開啊？同埋以往見到第1至到第4波呢，即係講緊本地零確診先至會停開啦。其實而家見到每日有幾千宗都可以停，其實而家即係香港嗰個抗疫目標係咪已經唔再係清零呢？同埋點樣可以確保新聞稿同開記者會有同一個效果呢？即係始終市民收呢個新聞稿嘅資訊啦，同聽你哋親口講，可能嗰個表達上面都有啲唔同嘅。咁第二樣就係想了解翻呢個0+3嘅措施呢，其實下星期1 6點就會正式實施啦。咁但係我哋見到有航空公司下個星期1呢，其實佢哋係有一班台北飛向香港嘅航班啦，其實係26號清晨嘅2點幾就降落嘅。咁其實嗰個航班上面嘅乘客應該係用3+4啊，定係0+3 3嘅措施呢？咁最後就係想問一問啦，即係見到孔繁麗教授呢，咁佢就話輸入個案嘅比例呢，如果佔整體係5% 以下呢，就有條件放寬到0+0。咁其實 CHP 當局係點樣睇呢？唔該。
多謝你問題啦。咁2年幾以嚟都多謝市民嘅忍耐啦，同埋對於各種防疫措施嘅合作。咁都希望大家可以繼續堅持同埋努力啦。咁希望我哋大家都可以好快可以過返一啲比較正常嘅生活啦。咁至於你話係你講嗰個案，即係9月26號朝頭早6點鐘，我呢個詳細嘅情況我都答唔到你，咁可能要會後睇下問翻啲同事嘅情況嚇，因為我哋嘅新聞稿就話係9月26號起嘅，咁係咪有個6點鐘嗰個我都要問翻。咁我知道其實而家我哋政府嗰個措施都係陸續係希望就係越來越減少市民嘅不便，但係都係達到個防疫嘅效果嘅。咁呢啲政府都會繼續睇住，然後睇下即係如果有空間放寬嘅話咧，就可能會再考慮嘅嚇。
下一位右手邊嗰位女士啊，咩2個行白色衫啊？
你好 Now TV 嘅，首先想問清楚嗰個輸入個案嘅數字啊，到底係150定係152定係153呢？同埋都想問下，其實過往呢係咪決定開疫情記者會都係取決有冇本地個案啦？咁到底未來其實會因應啲乜嘢標準決定當日有冇需要開疫情記者會呢？一啲大型嘅群組或者醫管局一啲醫護嘅群組會唔會都喺新聞稿入邊去清楚交代翻呢？第二就係想問下，即係今日都暫時係最後一次開疫情記者會啦，到底有啲乜嘢去提醒翻市民啦，同埋即係而家越嚟越多嘅措施都放寬啦，其實作為市民應該點樣去看待成個疫情呢？最後就係想問嗰個學校呢，有一間學校有2班需要停課，可唔可以清楚交代下到底係邊間學校同埋2班大概有幾多人啊？有冇關聯咁樣呢？唔該。
學校嗰度先啦。咁學校嗰間學校就係元朗公立中學會校友會鄧兆棠中學啦。咁喺元朗嘅，咁佢有2班係3B 班同埋2C 班，各自有4位確診人士，即係學生啦嚇。咁暫時就未見到有關聯嘅。咁但係每一班都有相當數目嘅人士，即係4位啦嚇。咁所以都係暫時都要停課1個禮拜啦。咁至於你話咩情況係會開疫情記者會，我諗其實我哋大家都係希望即係可以即係而家嘅疫情都開始回穩啦。咁我哋都希望咧就係用一啲即係風險嘅傳達嘅策略咧，都希望可以調整啦。正如即係調整其他嗰啲即係入境人士啊，或者係其他一啲社交距離措施一樣啦。咁我哋都希望係可以用翻呢個新聞稿嘅形式咧，就會代替翻嗰個每日嗰個陽性嘅個案數字啊，或者其他嘅嘢咧，我哋都會喺個網站嗰度更新嘅。咁另外係咯。輸入個案嗰度呢，就係152宗輸入個案，就係59宗喺機場嘅個案，55宗係喺檢疫中心、檢疫酒店嘅個案，同埋38宗喺社區檢測中心揾到嘅個案。我諗其實而家都係見到呢，即係我哋由呢個高峰嗰個個案嗰度就係即係要向下嘅趨勢啦，咁都係回穩嘅，咁同埋疫情都係維持咗都即係2年幾啦嚇。咁我哋都政府都係希望呢個市民都可以過翻一啲即係比較正常嘅生活啦。咁當然都係希望嗰個疫情係可以繼續控制啦。咁所以市民我諗都係要即係而家2年幾嚟都學咗好多防感染嘅措施啦，戴口罩啦、洗手啦，咁呢啲都係一啲好有用，可以避免一啲感染嘅措施。咁當然就唔係話全部啦，但係呢個都係一個比較基本嘅措施。即係可以睇到呢啲措施咧喺社區入邊咧好多嗰啲 上呼吸道感染嘅個案咧都係減少咗嘅，即係無論係流感啦、細路仔嗰啲個案啦，或者係其他嘅傳染病，咁大家都可以睇到呢啲措施咧係真係可以減到嗰個傳播嘅。咁但係當然即係其他嘅一啲真係防疫嘅措施，例如確診啊，咁你記緊要報啦，要隔離啦，咁即係遵守翻呢個政府一啲防疫嘅措施咯。
下一位。右手邊最後嗰行藍色恤衫嘅男士。
你好係友善嘅，都想問翻就係對外都放寬咗一啲措施咧，其實對內其實真係有啲社交距離措施有冇條件放寬多少少咧？就譬如話即係有冇話即係預計幾時唔需要戴口罩咧？另外就問即係有啲機組人員咧喺外地要遵守一啲閉環措施，翻到香港先可以免檢疫再加藍碼啦。即係佢哋都爭取同旅客睇齊，令到佢哋唔使即係喺外地逼喺酒店嗰度啦。其實你有冇即係覺得有冇空間可以放寬呢一個措施咧？唔該。
我諗其實政府或者醫衞局啊，或者成個政府咧，都不斷睇住好多唔同嘅措施嘅。咁如果有需要嘅情況下，或者係有空間嘅情況下咧，一定會考慮放寬嘅。
下一位，嗰邊最後嗰行嗰位女士。
兩位好啊，香港01嘅。首先呢，想問一問，琴晚醫管局要調整個死亡個案嘅統計啦，增加咗153宗。想問下點解會錯呢？係用咩方法發現嘅？咁之後諗住點樣去避免呢個錯誤呢？第二條問題就想問下，有專家呢就話新冠肺炎可能會成為一個風土病啦，你哋點樣評價呢個説法？咁香港嘅疫情係咪就之後可能會完結呢？多謝。
我諗其實呢個風唔風土病都要睇全世界嘅，因為其實香港都係一個對外嘅即係地方啦。咁其實即係我哋暫時而家啲個案咧都係有幾千宗啦嚇。咁你話係去到一個零嘅情況咧，我覺得嗰個機會咧就係比較細，因為始終都係即係你要全世界都係一清晒所有個案先至會有咁嘅情況。咁變咗而家即係睇落都係會即係呢個即係新冠病情咧，都可能會同我哋咧就係即係並存。
好，咁關於即係琴日我哋公佈多153個嗰個死亡個案呢，其實呢個係經過我哋同衛生防護中心提供嘅2019冠狀病毒嗰個確診個案嗰個更新名單之後呢，咁其實我哋發現部分嗰啲死亡個案嘅統計數據呢係需要作出調整嘅。咁所以喺調整咗之後呢，咁我哋就見到喺我哋醫管局呈報嘅死亡個案統計當中呢，係多咗153個個案。咁大家都理解啦嚇，其實喺即係最初期喺2月至4月咧，嗰個即係死亡嘅啲個案咧係一個高峰期嚟嘅。咁而呢啲個案咧亦都係喺嗰段時間嗰個發生。咁當然啦，嗰陣時亦都嗰個確診嘅情況，即係嗰啲個案多啦，咁死亡個案亦都係多。咁我哋喺即係調整咗其中嗰啲即係數據之後咧，我哋發現其實有一啲個案咧，其實係喺我哋個系統入邊未有一啲確診嘅記錄。咁但係喺核對咗即係頭先講衛生防護中心嗰個確診名單之後咧，咁我哋就發現有啲係要即係加咗落去嘅。咁另外有啲部分病人離世咗之後咧，我哋喺我哋嘅系統當中咧，發現佢嗰啲快速抗原測試嘅確診記錄，咁但係咧就未有一啲即係確診身份嘅資料嘅核實身份。咁所以咧呢啲個案咧，其實都要係即係納入去一啲死亡嘅個案統計數據入邊。咁另外就係有一啲個案入邊咧，佢可能有一啲比較早期嘅確測咗陽性嗰啲日期，咁嗰啲如果計翻咧就唔係合乎翻喺一啲新確診病人情報嘅定義當中，咁所以有啲個案咧就會喺一啲統計嘅數據之中咧就會剔除咗。咁所以喺我哋即係做晒呢啲調整嘅數據之後咧，咁我哋就會喺嚟緊嗰啲疫情嘅專題網站上咧係會上載翻有關嘅數據啦嚇，就會係咁。
下一位右手邊尾二嗰行嗰位男士。
兩位醫生好啊，港台嘅先想問翻張竹君醫生啦，因為即係之前出稿咧就係嗰死亡個案係咪其實應該係過萬，但係頭先都講話係即係9000幾，我想問清楚嗰個數啦。同埋即係而家嗰個確診數字咧，其實都即係持續回落啦，而家去到5000幾，有冇話即係你會點樣評估？其實可能呢一波可能會跌到咩水平，跟住就相對係會持續一個可能比較平台橫行嘅，即係會唔會繼續持續一段時間都可能1000幾宗啊嗰啲咁嘅水平，可唔可以即係評估下啦？另外即係會唔會話都形容咧，即係因為都唔再暫時都可能唔再搞記者會啦，會唔會話都可能係一個即係新嘅階段？你會點樣即係去形容？其實係咪都可能係本港嘅疫情都可能走到終章啊、尾段啊咁樣？即係可唔可以都分享下其實呢2年幾3年嘅抗疫嘅工作啦，即係尤其是你都呢段時間都日日都成日出嚟啦，會唔會話可以有啲咩艱難嘅時期，其實你都覺得好困難啊，其實可以向即係大家分享下你嘅即係感受，唔該。
我諗而家嘅趨勢都比較難估計佢會點啦嚇，咁但係我哋睇之前嗰啲趨勢就係佢係慢慢向下嘅，至於係向下向到幾多數字，同埋會唔會話再有啲反彈啊？咁都有機會嘅嚇，咁但係都希望就算反彈都唔會反彈得好多啦，因為其實而家嘅情況可能即係都有好多人打晒針啦。咁有好多都係感染過啦，咁可能都喺個社區入邊咧有一定嘅免疫力啦嚇。咁就算真係有啲個案咧，都希望呢個重症同埋死亡個案都係即係一個唔係太高嘅位啦。咁我哋新聞稿嗰個總數咧，如果係第5波疫情就係琴日講就係9886宗嘅，嗰個累計死亡個案咧就講緊2019一開始，即係由第1波開始計嗰個數嚟嘅。咁嗰個喺第1至第4波咧都有213宗嘅，咁所以就係加翻嗰個就係超過咗1萬宗。我諗個人感受嗰啲就唔方便喺呢度講啦嚇。
下一位答英文問題啊，左手邊呢位男士。
Hi, good afternoon, doctors. Some questions from the South China Morning Post. First question is to ask the CHP and whether they think now that the pandemic has sort of stabilized, is there any room to relax the social distancing measures? And the second question, earlier you mentioned that it would be hard for Hong Kong to go back to zero. Do you mean that in which by saying that it'd be hard to achieve the zero COVID situation that the government wants to achieve? And lastly, with the suspension of the daily 4:30 press conferences, I wanted to ask, is there a threshold into when the CHP will decide to hold these press conferences again, perhaps when cases break above 10,000? And on a separate note, as these press conferences will be suspended today, is there anything that the CHP or perhaps the HA would like to say to the wider public before these press conferences are suspended? Thank you.
I will answer first. I think the government and also the Bureau will be closely monitoring the situation in Hong Kong, and if there is any further, to closely monitor the situation, and if there is possible, it would announce new measures to relax. And I think that now we have gone through the 5th wave since early this year, and majority of the population have been infected and or fully vaccinated, but we still have quite significant number of cases in the community, and it is very infectious, and it will be very difficult to achieve 0 cases in the community. So at present is our thinking, and we don't have a threshold of number of cases that we will revert at the press conference, but if there is any situation that on a case-by-case basis, we may hold press conference every now and then, just like before the COVID pandemic. Yeah.
So on the HA side, We are aware that the situation, the confirmed case has been decreasing, but still we urge the public, especially the elderly and the child, to stay alert and to seek medical help if they have any symptoms. And I also want to tell our citizens that we are still running our community facility. For example, for those designated clinics, the teleconsultations and also the drug delivery service, as well as the hotline. These services are still maintained because we want to ensure that our public will receive the appropriate care during this difficult time, and also to ensure that if they can have the medical consultation should their condition changes, so that this will help our healthcare system to decrease the pressures. Besides, we are working towards to resume our normal hospital activities. And for example, we have announced yesterday the general outpatient clinic has been reverted to some of the previous suspended services. And also we are working towards to resume some of the non-emergency service as well as the day service. And hope that we can at the same time take care of those patients who do not have the COVID, and that's what we want to tell our public.
I would like to ask the public to keep up the personal hygiene measures, such as washing hands, wearing masks, keep social distancing, and obey all the prevent and control measures. The prevailing prevention and control measures as advised by the government.
下一位，最後嗰行嗰位女士。
你好，兩位明報嘅。首先想問翻，即係輸入個案 breakdown 嗰度咧，喺檢測中心嗰度有幾多係4至7日啦，有幾多宗係7日之後嘅個案啦，同埋另外都想問翻 HA 嗰邊，即係頭先提到一啲調整死亡個案嗰度係喺 HA 系統度冇資料，可唔可以講多少少個情況係點？係咪即係譬如有啲 patient 係喺街上面暈低啊，身份即係身上邊冇證明文件，所以 check 唔到佢哋嗰個情況咁樣咧？同埋想問下，即係而家檢視死亡個案嗰度 die of die with 嗰個比例係點樣？同埋會唔會都檢視下有啲死亡個案可能係同新冠無關，係可以剔除翻喺嗰個萬幾宗個案之外咧？另外就想問翻 CHP 頭先提到話可以放寬一啲社交距離措施啦，有冇話提到即係估計或者中心評估，如果放寬嘅話，邊啲措施係適合放寬先咧？同埋即係要睇啲咩條件先可以研判一啲措施可唔可以放寬咧？唔該。
我諗我冇話可以放寬社交距離措施，我話其實政府都會係密切注視住呢個疫情啦。咁如果係可行嘅情況下，有空間嘅情況下，就會考慮放寬嘅。咁嗰個輸入個案呢，就係第1至第7日喺社區檢測中心揾到嘅個案係有32宗，第8至第10日就有6宗。
至於頭先你提到嗰個情況，好似話譬如話嗰個病人或者佢嚟到我哋嘅醫療系統，可能譬如喺急症室已經過咗身，咁但係可能之前曾經去做過一啲即係快速嘅測試話好，或者核酸檢查好，咁可能喺咁嘅情況之下，可能我哋真係未必掌握晒所有嗰個資料嘅嚇。咁另外你話至於嗰啲死亡嘅個案 die with 定 die of 嗰啲咧，我哋其實而家咧都係一路都係仲係即係睇緊一啲個案嘅，咁所以可能未係一個合適嘅時間去即係俾一個結論啦嚇。
下一位，右手邊尾二嗰行最遠嗰位女士，我哋帶埋最後呢位。
你好，我係大公報，想問下莊醫生，就係呢2年幾都差唔多日日都開記者會啦，想問下可唔可以分享下呢幾年最難忘一個時間，同埋想問下係咪都希望呢一次係最後一次疫情記者會？唔該。
我諗講過，我其實都唔適合分享個人感受。不過當然我都希望呢個係最後一次記者會啦。咁我都趁呢個機會就祝大家就身體健康、生活愉快啦。
記者會完結，多謝大家。